Live news conference underway now with Governor Gavin Newsom. Let's listen in.
About the last number of months. As you may recall, California was the first state in the nation to formally engage with the CDC, the Trump administration, and others in relationship to this pandemic. We engaged formally by allowing the repatriation of flights from overseas, primarily from mainland China, to come into the state of California. These were conversations that occurred in late January and early part of February. Those relationships were formalized through a series of agreements that allowed for that repatriation. COVID-19, this pandemic, the coronavirus, as it was referred to at the time, was on our radar screen for many, many weeks before, in fact, it became a framework of reference for the nation. We had the opportunity as well to develop further relationships, not only with the federal government in partnership with the CDC, but also HHS and other federal agencies, particularly FEMA, when it came time to repatriate that cruise ship. You may recall a number of months back, we had a cruise ship off the coast of California, thousands of passengers and crew that we ultimately became responsible for in terms of bringing them back onshore and then bringing them back all across the rest of the country, and for those many not only passengers but primarily staff, getting them back home overseas. Those relationships furthered our resolve, our recognition of the imperative to meet this virus head-on. Also began the process of protocols and procedures for addressing the need to hospitalize individuals, to test individuals, to provide alternative care sites outside of the hospital system for individuals, and began the process of rationalizing our approach. We formally moved forward as we started to see the spread in Washington State, skilled nursing facilities, and we saw and experienced our first community spread here in the state of California outside those repatriation missions. We moved forward as the first state in the country with a stay-at-home order on March 19th. And that began the process of really developing strategies and partnerships with local health officials, county elected officials, all up and down the state of California. Remember, California's 58 counties, over 470, almost 480 cities. And when we talk about our state, we talk about scale and size and scope that is equivalent to 21 states' populations combined. So it's trying to reconcile our challenge, but also trying to reconcile the differentiation in regions, large and small, all across the state, became a big frame of focus and engagement at the local level. As a consequence of that, we started to socialize the term localism is determinative, meaning local conditions are such that local electeds, local health directors have a unique understanding of the criteria of concern, also the criteria to which they would afford a remedy to those concerns as it relates to the spread and the transmission of this virus. We started to see density of transmission in certain parts of the state. Other parts of the state just didn't experience any real transmission. We saw deaths increasing in certain parts of the state. We did not see that in other parts of the state. Many counties, many regions asserted themselves, understandably, making that point that they're different from other parts of the state. And we began the process of what we refer to as attestations. And these were locally directed attestations, attesting to certain criteria, certain responsibilities, certain procedures and plans that would be put into place through a technical engagement with the state of California that would allow certain parts of the state to open a little bit more quickly than other parts of the state if, in partnership with the state of California, they attested to being prepared and being accountable and responsible for the transmission of this disease. You recall at the time we talked about making sure that part of that attestation includes making sure you have adequate testing, making sure you have adequate capacity to begin the process of contact tracing, making sure you have appropriate levels of PPE, personal protective equipment, not just face masks, but gowns and gloves and the like. We also had responsibility within the hospital system to make sure that they could address possible need for a surge, and that include not just hospital space, but also prospects that they have enough ventilators and ICU capacity as well. We also had a framework of focus on homelessness, on issues related to seniors in our skilled nursing facilities and our residential care facilities, as well as people in congregate facilities, locked facilities, county jails, adult correction facilities, and the like. Butte County was the first county to move forward with an attestation, and we started our phased approach to reopen the economy here in the state of California. We talked in terms of 4 phases. We have been clear through the attestation process that we will allow counties to move forward on their own time through 3 phases, not the 4th phase. And I'll remind you that 4th phase is large-scale festivals, outdoor facilities and concerts, rather, facilities like convention facilities and the like, large events, for example, sporting events. That's all in that 4th phase, and no part of the state of California is allowed, even through that attestation process, to move in to that 4th phase. But people are pacing in and through phase 2 and phase 3. We had, at last count last week, we had over 52, and then we went to 54 counties that have gone through this attestation. We highlighted one county that was interested in moving forward to the attestation phase, Imperial County, but was simply unable to attest that the conditions were such that they can mitigate the spread of the virus and also protect their citizens if indeed there was a surge. On Friday, I highlighted Imperial County as an example of a county that not only did not move forward with an additional attestation, but needed, we believe, and continue to believe, needed to move back. That despite the fact that they were not able to attest to go in deeper into this phase 3, they were able to open some parts of their economy. But even so, the spread of the virus in Imperial County was such that we as a state were working with that county to decompress their hospital system. Over a 5-week period, just a 5-week period, we had to move 500 patients out of their hospital system into surrounding county systems, putting a lot of stress and strain on the surrounding systems, but also only reinforcing, the imperative to address the conditions in Imperial County and address why the spread was continuing at such an extraordinary pace. And when I mean extraordinary pace, we had positivity rates. Remember, positivity rates, number of people tested, percentage of people tested that test positive, positivity rate. We had positivity rates in Imperial County as high as 23%. And that raised red flags. And over the course of many, many weeks, we've been supporting. Our technical assistance teams have been sent down there, federal, state, regional teams, including just this weekend, where we sent down 3 of our cabinet secretaries to meet with representatives and to only reinforce our support to address the conditions in the county. We encouraged the county on Friday to begin to phase back, to use what we referred to over the course of the last few months as the dimmer switch. We talk about these attestations, but they also have a dimmer component as well. What you attest to is also your capacity to toggle back, to dim the reopening, to move back into a place where we can mitigate the spread. And that's exactly what we are requesting of Imperial County. Their formal County Board of Supervisors will be meeting today and tomorrow and making that determination. If they are unsuccessful in building consensus around going back into a stay-at-home order frame, the state of California will assert itself and make sure that happens. Accordingly, and I highlight Imperial as we did on Friday, just to underscore the unique characteristics and conditions that persist and exist throughout the state of California. But there are also many other parts of the state that we are monitoring. In a moment, I'll get to some slides and show you more specifically the number of counties that we are currently monitoring and what that monitoring looks like. Dr. Galley will come up and talk a little bit more specifically about what the criteria and conditions are to end up on this monitoring list, this watch list, and then work we will do as a state to begin, again, to use that dimmer switch as we are suggesting and ultimately require in Imperial County. By the way, that's exactly what we did over the weekend. On Sunday, recognizing the transmission has increased in areas of the state, not just in Imperial County, we moved forward to require 6 additional counties to, for example, toggle back and use that dimmer switch by closing down bars in order to slow the spread of the virus. We also recommended yesterday, Sunday, that 8 other counties consider doing the same. We, as I said, working very closely and collaborative with Imperial County because we believe they need to move back into that stay-at-home posture. The bottom line is we're doing this because we have seen an increase in the spread of this virus. We've been very clear, and this shouldn't surprise anybody watching, as you reopen the economy, as we move away and make the meaningful modifications which we did to our stay-at-home order, you're going to see people mixing that otherwise were not mixing in the past. Many people were not necessarily being as responsible as they otherwise, as we would like them to be as it relates to practicing physical distancing, social distancing, people that weren't wearing their face masks. That's why a week plus ago we required mandatory face coverings, face masks in the state of California to help mitigate the spread. We need to take further steps, and that's exactly what we did this weekend on Sunday by closing down some of the areas of concern. When we talked to health officials up and down the state, one of the areas of concerns was bars in particular. Other areas I can get into, like family gatherings, which is something we all should be very, very cognizant of, particularly as we move in to 4th of July weekend. We'll talk more about that over the course of the next few days and our concern from the health perspective of people mixing, extended family, and other people coming together and congregating that otherwise are letting their guard down a little bit in mixing. That is also one of the reasons we're seeing an increase in the total number of positive cases in the state. But we start with bars in these counties, and we have 8 counties, as I said, on top of those that we have mandated the closure, that we recommend the closure. Let me tell you the criteria we put forth for the bars. That's 14 days where we have seen these counties on the watch list, and that becomes the criteria. Once over a 2-week period, and you're still on that watch list, and we're still seeing an increase in spread and transmission, that then triggers the kind of decision that we made yesterday. The 8 counties that we're recommending, those are on a watch list, but just 3 to 14 days. None exceed the 14 days on the watch list, but none are less than 3 days. And we're encouraging, working in partnership with the health officials in those counties to consider similar guidance, and to the extent that they choose otherwise after a 14-day period, we'll assess that and we will make the determination, our health team, as to whether or not we will ultimately make that decision for them. So that's the recent weekend actions, the Friday announcement, if you didn't have a chance to tune in on that, around Imperial County and the supports we're providing that county, and obviously now the actions we've taken as it relates to the bars. But let me now show you why that's the case. Here's the case numbers from Friday. 5,932 new cases on Friday. Saturday, 4,810. And, of course, you see the Sunday numbers. This is the latest reporting period, 5,307 cases. That represents over a 7-day period. If I went back and provided you another slide just to give you a sense, a 7-day snapshot, in the last 7 days we've seen a 45% increase in the total number of cases that have tested positive in the state of California. There are a couple reasons why that's the case, and this slide is an important slide to underscore that. Again, forgive me, I've repeated this many times, showed this slide on many occasions, but it's an important slide. The first 14-day cohort of positivity rate in the state of California that we recorded showed 40.8% of people that were tested positive. The last 14-day period, we are now at 5.5% positivity rate. But you see on this graph, those of you that are watching, not just listening, on this graph, a significant increase in the blue lines here. The blue lines represent the total number of tests in the state of California, from less than just a few thousand in April to a record number yesterday. Just shy of 106,000 tests were conducted yesterday. So again, we expect when you test over 100,000 people in just a 24-hour period, you're likely going to see more people test positive. But not only are we seeing that, which is represented in that 45% increase over the last week in total number of positive cases, but the positivity rate is particularly concerning, and this is why we are monitoring it very, very closely. And let me give you another slide here to see more specifically the concern. Just a couple weeks ago, we were at 4.4% positivity. And you recall, the reason we started to reopen our economy is we saw the positivity rate remain very, very stable. Number of hospitalizations and ICUs for many, many weeks, arguably a few months, was incredibly stable. And just in the last few weeks, you're starting to see, when you take a closer look at the positivity rate, an increase that raised the concerns that led to the decisions we made on Friday in Imperial County, led to the decisions we made over the weekend as it relates to shutting down bars in many counties in this state. 5.5% is of concern. It's not where some other states that are generating headlines are. They're substantially higher, but we don't like the trend line. And that's why, again, this mandatory mask requirement is in effect, and that's why, unfortunately, we're using this dimmer switch to start to pull back on the stay-at-home order. By the way, that 5.5% masks, forgive me, but it doesn't mask the 7-day trend, which is at 5.9%. So 5.5, you see here in this chart, is the 14-day. Just the last 7 days, we're up to 5.9% positivity. As it relates to hospitalizations, not surprisingly, accordingly, you're seeing hospitalizations increasing in the state just over the last 2 weeks. Hospitalizations have increased by roughly 43%. 43% in the last 2 weeks. You'll see, though, here, in terms of our total capacity as a system, our capacity absorbed this. And I just want, again, to take a moment. All of these months, when we did the stay-at-home order, we didn't sit on our hands. We worked aggressively not only to engage with our county health officials, as I noted at the top of my remarks, but also to engage them with purpose and intention, and that is to really assess what our needs are in this state to work our way through the first wave of this pandemic. And remember, we're in the first wave, and then to prepare for a second wave, which many experts believe will come later into the fall. That included making sure we had a health care delivery system that included alternative care sites, included hospital beds, and plans, protocols, and procedures to significantly increase our capacity within and around the system, not only in terms of physical capacity, but also human capacity. We have this team referred to as the Health Corps. We identified personnel and appropriate protective gear, and worked to really build out a robust framework for our planning purposes. In this slide, you'll see reflected our current capacity as it relates to hospital beds in the state, just shy of 75,000 hospital beds in the state of California, 73,867 to be precise. And by the way, that number changes on any given day for a myriad of different reasons. We currently have, you saw from the previous slide, represented.
You've been watching the governor's live update. Our coverage continues streaming on CBS Bay Area, but the governor once again highlighting some of the counties in the state with a higher number of COVID cases, also emphasizing why certain counties need to maybe think about scaling back on reopening. That, of course, includes some Bay Area counties that the state is keeping a close eye on right now. We also just learned that yesterday California had 5,307 new positive cases of coronavirus. That's a 45% increase in the last 7 days. Again, more coverage of the governor right now on CBS Bay Area.